Hi, Peggy.
Hi, Elmer. How are you?
I'm doing okay. I'm really glad that at least today it's sunny outside.
It does make a difference, doesn't it?
It makes such a difference. The important question is, how are you?
I'm doing fine. This is unprecedented time. I've been in healthcare for over 30 years now and been through several different aspects of healthcare. And this is unique, it's different, unprecedented. And so I'm so blessed to have a great team of people at Children's Hospital. I I thank God every day that I'm so fortunate to have the people that I'm able to come to work and really do everything we can to make sure that we're doing our best work for our kids. So yes, it's very sobering, it's very concerning, but when you know you have a group of people that can just really all pull together, and in the face of some really difficult times, it really does make your life a little bit more pleasurable than it
Yeah.
typically would be if you had to fight this thing on your own.
So I have to ask you, you are as much on the front lines of this crisis as anyone is. Um, what's the perspective that we're not getting when we watch the news and read the newspapers?
Well, we're getting mixed perspectives. And so the one thing I really hope people understand is this is serious. Um, this is serious and it's spreading. And we have not seen the surge yet. We're pretty confident that the surge will occur sometime in mid to late April. And what we need to do is do everything we can to flatten the line because this is serious. People die, people are sick, and it changes the course of people's lives. And so that's my one request is that people really pay attention, stay at home, wash your hands, wash your hands, wash your hands, and take every precaution necessary so that Wisconsin can come through this very differently than other parts of the country. We have so many resources and assets, and we were proactive in doing some of the things like the stay-at-home order. Uh, Getting in front of that a bit before the surge came, I think is going to be very helpful in the end. So I think that this is serious, it's important, and it's coming, are the most important messages that I would suggest people need to pay attention to. And there's a lot of numbers and data and speculation. We pay a lot of attention to the Center for Disease Control. We really think that they're basically a source of truth. Dr. Fauci is a source of truth. And I think that, they are respected scientists, some of the best in the world. And so I take personally, being in the forefront of this, I take a lot of my clues and cues and predictions based on what they have to say. We've had the CDC here at Children's. They've helped us immensely, making sure that we're doing the right things. And so it gives me a level of confidence that the changes we've made, the things that we've enforced are really the right things to do, not only to protect our workforce, but also to prevent the spread and take care of kids.
And take care of kids. So, we hear a lot about the shortages of PPEs and other various healthcare equipment
Yes.
supplies. How's that affecting you? Do you see a relief from that in sight, or?
So it's affected us. It's really affected us in some very significant ways. The shortages of protective gear for our nurses, doctors, respiratory therapists, and others in the front lines has been serious. It has caused us to change many of our practices, and we've had to do it very rapidly. You can imagine that a hospital, a care environment has some very strict and very traditional ways you do things. And because of the shortages, like I said, we've had to implement things, we've had to implement them quickly and communicate as effectively as we can with our frontline workforce to know what the changes are and the reasons behind the changes. So a couple of things. One, particularly with the PPE, you'll notice that we have canceled elective surgeries. We've really limited our well baby visits and some of these other things because we don't have the ability through the lack of PPE to safely provide the services that we believe are typical for what we do. We're asking people to reuse masks and gowns. That's very non-traditional in healthcare. And so, and it's a major change management issue that we've had to really encourage people that this is okay, it's CDC guidelines. So the PPE shortage is real. There are speculations that will come available, but you have to remember a lot of that PPE raw material is actually coming out of Wuhan. And so when they shut down, the production of that shut down. Supplies are now coming into the state. One thing that's happening is sometimes you'll have a order in with your suppliers and only to find out at the entry port, they were diverted to the federal government. So the predictability and the assurance that we need to have about where we will get the supplies is not as certain as we are typically enjoying. Now that said, we've had an outpouring of support from the community. We've had several donations of N95 masks and gloves and gowns. Not enough to fill our void, but I'm so grateful to the community. It just speaks volumes of the generosity of the state of Wisconsin and Milwaukee because people are really doing everything they can to help. So the second thing is that we very early on in the outbreak have the testing capability here at Children's, right? At the Children's Hospital. We were one of the first ones to have the statewide approved testing for H1N1. So we have a very credible group of very, very skilled people that can perform these tests. And we can perform them and turn out the results in 4 to 5 hours, which is really fast by comparison because you could wait a few days or a week. The problem is that we don't have access to the swabs. We don't have access to the reagent to run the test. And so we're down to about 300 now that we can run, and we have to save that and preserve that for our patients and families first, our staff as well, so that if they have symptoms or there's an exposure, we can adequately test them to understand the prevalence. We are not able to do this in the community, again, because of the lack of PPE for our staff to be able to perform the test, and also the reagent, the swabs and the reagents. And that, so when people are saying, why aren't you testing more? Why aren't you testing more? All health systems are facing this right now. We hope that this new Abbott test does come. The scientists are saying it's a credible test. It's a rapid test. It's 5 to 15 minutes. We understand that right now the supply will go to the federal government and be reallocated out. But so I see a hopefulness coming out the other side based on the production of the of this new test. The other thing we've had in this community is we've had some really nice turnaround of individuals who are willing to change their typical manufacturing ways in doing things to help us with the lack of the PPE. So for instance, Alan Edmond came to us and said, we can make masks. Our sewers are looking for things to do. And so they were able to supply us with masks. I've got mine on and I wear it when I'm in the hallways or I'm walking through the hospital or anywhere where I could expose a person. So we've been able to give these masks to every one of our employees. And thanks to Alan Edmond, we have at least a supply of these. Now, these are not surgical grade or N95 grade, but they do protect. So we're grateful. Jockey is turning around to make gowns for individuals. And then we also have another company that is a microbrewery who is switching their production so that they can produce hand sanitizer. So again, good creative thinking, wonderful ways in which the community can help us to help our ability to protect our employees and take care of our kids.
And we love those kinds of positive stories. And speaking of breweries and distilleries, we know that a company called Central Standard, which has a great relationship with Scale Milwaukee and the GMC, is one of those that has converted their operation. Yeah. So you brought up
now, let me tell you, it's interesting because they can convert it. They have all the equipment in terms of the alcohol and yada, yada, yada. Well, so you get through this and then you find out you can't get the pumps and they're making it in gallons. And so we don't have a supplier, or they don't have a supplier for the pumps. So there are many steps along the way that have to be thought through before you have the assurance that this product's going to come. So we're working with UWM, Concordia, and Marquette to develop, and Herzing to develop an N95 mask. The rate limiting factor on that is that 3M is the only producer of filters for those, and we don't have access to the filters. So again, a lot of really great work. Mm-hmm. We have to get through the whole production process to put it into the supply chain.
So you mentioned the change management that you're enduring and the wholesale cultural shift that you have to enable in your organization. Talk to me about your communication strategies with your people. We've been lucky enough to talk to several GMC members who have to unfortunately lay off workers or who have to downsize the workforce. Your situation is different in that you're asking people to expose themselves to some personal danger. How do you communicate and lead through that kind of challenge?
Well, so one thing we did back in 2012 is we really went into a major cultural revolution at Children's, and that has sustained itself over these years. We ground it in our values, and we communicate in a language with both our nurses, our doctors, our social workers, our check-in desk across the whole organization. So we've got the benefit of already having a cultural infrastructure that allows for strategic agility, innovation. We always talk about our value of purpose, integrity, collaboration. So we're using that cultural work to drive how we're communicating. And because it's so familiar to people, it's working. When you can ground it in your values and really use the tools that you have as a resource. We have a phenomenal marketing and communication team led by Tricia Garrity. And so we have an incident command center that's been set up. We set it up over 3 weeks ago, where all decisions, whether it's dietary, environmental services, supply chain, direct care, it all funnels through the incident command. The communications team is integral to that. And so we are communicating on a regular basis through multiple channels to get to, we've got 6,000 employees in 40 locations across the state. So, it's not just here in Wauwatosa, it's a statewide phenomenon. And so we're using social media, we're using webinars, we're using written communication, and we have it on a consistent, regular basis, but then also if there's a change, because some of this rapidly changes, we have tools and techniques that we can push that information out. Because I'll tell you what, even when I'm making rounds on the front line and talking to the nurses and talking to the teams, that's the one question I ask them is, do you feel like you know what's going on? And the answer across the board has been yes. So it's working, it's making people feel better, and it's really letting them feel that we care about what matters to them. So
I love that. And you have really, from what I understand, built an extraordinary and robust system for keeping your people informed. I guess I should ask you, a lot of your GMC peers are parents, and some of them are even grandparents. What do they need to know that they might not be hearing in the general mass media?
Well, they need to know that a couple of things. So we know for a fact that kids can develop COVID-19 and be asymptomatic. They're tough little guys, and those little kids can just, they can be walking around with it. And so that's one factor. And actually, there's many of us that could be walking around and not have symptoms, but still be a carrier. The second thing is that we know that there's high-risk groups, people over 60, especially if they have comorbidities, but then anybody that has comorbidities is at risk as well. And so, the one thing we thought about is that as, the schools are not in session, and the people that have to work may be relying on grandparents to take care of the kids. And I think the thing that they need to know is that, there is risk in this, but I think there's good practices that can keep them safe. And again, staying at home, washing your hands. And if somebody becomes symptomatic, they do absolutely need to call their doctor. Don't show up at an emergency department. The first thing you do is call your doctor and get advice on what to do next. If you've got mild symptoms, you can stay home. Now there's a 14-day quarantine that you really need to listen to and pay attention to, and stay away from people that are at risk. But be prudent. And if you do start to have significant symptoms, you need to go to the emergency department. So now the other thing I'm going to tell you is, obviously this has put stress and all sorts of different obstacles in front of people. One of the things we're very concerned about is the mental health stability of families and households and things like that. And I've spoken before about the fact that Children's has embarked on a major mental and behavioral health initiative that we're rolling out as we speak. It's community-wide. So I think the other thing that people need to know, that the strains and the stresses that are already there are going to amplify, and to look for ways to mitigate. We've got online help for our staff and for families to call in. We've got banks of people that can answer phone calls. You can go to our website, chw.org, and get some information. We've got information about, what you need to do with your kids at home who are not at school, and how you keep them active, and look for clues, because this is a scary time for people. People wearing masks. I mean, that's a different dynamic for us. And so trying to really get a hold of where you're at mentally, and then what kind of coping skills and techniques do you need to make sure that you can come out the other side of this, because there will be another side of this in the most healthy and dynamic way.
So might I ask you quite personally, how are you making sure to take care of yourself? This is such a stressful time, and what are you doing?
Well, so I'm a few things. First of all, I feel I'm looking for things of gratitude all the time. And again, I'm so grateful for my coworkers here, because I couldn't ask, like I said, for a better group. My husband's amazing. Now, I'll tell you on a personal note, I have a daughter that's a pediatric intensive care physician, and a son-in-law who's an adult intensive care nurse. So they're in the workforce every day, and I'm with my 3.5-year-old granddaughter. So, I have personal strains as well as my professional strains. But I'm eating right, I'm exercising, I'm trying to get enough sleep. I've got a very supportive spouse. He's been wonderful. But I'm really trying to pace myself in a way that I can be here for the next 2 or 3 months as we navigate our way through this thing. But it's really important to get in tune with your feelings and know where your stressors are, and try to get your arms around that for everybody. Because there's going to be a new normal coming out of all this. We've changed other things at Children's. We have gone digital. And in fact, we've been trying to institute digital connection with our families, because remember, our families are mostly the 20 and 30 somethings. And we were making good pace in this, but we realized that our ability to digitally connect with people is incredibly important right now. And not everybody should come to a clinic and be exposed to others. And so we're using digital tools for both urgent care and our primary care. And we were pacing along at a good adoption curve, but that's just amped up. And when I say there's a new normal, I think that there are going to be some fundamental changes to how the healthcare systems connect with people. And I think these are going to be very positive at the end of the day. So I do want people to know that as you come out of this, there are some things that will create a new normal, and they're good things. And
they're good things.
Yeah, my fear, and I tell my team this all the time, is that we're going to come out of this and have found some new ways to do things. And let's not go back to the way we did things just because that's more comfortable, because these new ways are going to be better. And that's the hope.
Do you have a great story that you've been reflecting recently, or just an uplifting case study, if you will, that's worth sharing?
Well, okay, I'll tell you one thing that happened in the midst of all this is that there's a very, very important certification that hospitals go after called magnet status. And it's actually a very rigorous and in-depth evaluation of your care particularly your nurses, because it comes out of a credentialing organization, a nursing credentialing organization. And so we just went through in the fall our 4th evaluation for magnet status. And we heard last week that we now were able to attain our 4th, and we're one of 69 health systems in the world that has had magnet status for the 4th time. So when I got to go around and announce this to the nurses to let them know that they had achieved it, in the face of all the things they're dealing with right now, the smiles and the, oh my gosh, this is so great, and I'm so excited. So we were able to uplift people in the midst of all this, and let them know the work they do is really important and it's very special, and that they need to keep doing this great work. So that to me was just a wonderful moment in time to be able to celebrate with
Congratulations.
some
That's
of the best people I get the chance to work with.
very exciting. And, you know, as much as that is a testament to the great work you're doing, I think that's the kind of success that, frankly, we can collectively own for the region. You know, Milwaukee's got one of 69 in the world. That's fantastic.
Well, and I'm a nurse, so it's even particularly special for me, you know, being a nurse and being able to celebrate with the nurses. So yeah, that was a proud moment. But you know, I can think of incidences, but I have to tell you, my favorite thing to do is walk around the hospital now with my mask on. So I'm hoping people recognize me. But and being able to just what's on your mind? We have a value of health, and are you getting enough rest? Are you getting enough sleep? Are you balancing things at home? You know, because here's the other thing that happens to healthcare workers. You know, their loved ones know that they've been in a very high risk environment, and you know, they're coming home. They're, first of all, they're very worried about them at work, but then they're coming home, and are you bringing the stuff home with you? And so trying to make sure, and now their kids are at home, and you know, the life disruption. So it's really important to me that people are, like your question of me, taking care of themselves and able to manage. We set up a Facebook page for people who might need additional childcare issues. And so we have 179 people that are now on that Facebook page, and they're helping one another with childcare issues. We have a labor pool now. I think the one thing I also want the business community to know is that while you think the hospitals are extraordinarily busy, we are busy in a different way. So when you cancel elective surgeries and you're not doing procedures and you're not seeing patients in your specialty and primary care clinics, there's a significant revenue issue. And so, you know, we've got the same issues of what are we going to do about people who are not needed in the workforce? You know, how are we going to continue to pay them? Because when this thing comes out the other side, you can imagine our business is going to amp up quickly. We're going to do, we're going to start doing 7-day-a-week surgery. We've got, the general surgeons told me today, they've got about 1,000 cases right now today that when this thing opens up, they need to start scheduling because there is still work. But in the meantime, you know, we've got people that we're going to face similar situations. So while this has come down to a bit of an economic versus healthcare debate, you know, with the stay at home, we've got we're all together in that same situation. And so we've stood up a labor pool, and we've got people doing screening at the front door, helping with the cleanliness, and fortunately have several people that have signed up in our labor pool so we can reassign, and we use about 70 to 80 people a day in different roles from what they are typically
doing,
and doing jobs that we need them to do. And people have been very generous with their time on that.
So what would you like from the GMC members, or what would you like to offer them?
I'd like to offer them two things. One, please, please, please listen to our advice about stay at home, wash your hands, and keep safe. Don't let us hit a surge. And then the second thing I'd like to say to them is there's a hope message in all this. There will be a time we're going to come out the other side. And while it's very difficult right now, and I live it every single hour of every day, we need to be thinking about, okay, so what's next? Because if we don't have hope, and if we don't try to look at the, you know, where this can go, I think that people get incredibly discouraged, and it's a doom and gloom message when you think about the statistics and what's happening particularly in New York and New Orleans and Washington State. It's very serious. So those are a couple of things.
I appreciate that. So first I want to offer my gratitude and thanks for you making some time. We do know how busy you are.
Yeah.
And I'm happy to conclude this conversation, but would love to finish on a high note. So why don't you finish us off on a high note?
We're a great community. The GMC is a phenomenal organization. I've gotten so much out of it in my years of being here, and I think it's a way in which we collaborate and we look for new and different ways to do things, and we're all making Milwaukee as the strongest city in the country. Our vision at Children's is we want the kids of Wisconsin to be the healthiest in the nation, because we want to have the healthiest city and state in the nation. So we're going to keep plugging away at it.
I love that. Peggy Troy, thank you so much. I'm looking forward to talking to you soon, face to face.
Thanks. Thanks for your time.